Right, so we have a broken tooth today, emergency. And what happened here is that there was a crown here on this tooth and it snapped off this little tiny root here. And when we look at the x-ray, we see on the x-ray a short root with a root canal done and the flipped off crown that you can't, obviously not in the x-ray, but you can see the space there. Also, another thing is that there's an infection in the top. And how do we know there's an infection? It's quite easy to see. We see a dark circle on the top, and critically right around the dark circle, we see a white circle. And that's an osteitis, meaning the bone grows quicker there or thicker there. That's why we see the white line in response to the inflammation from the infection in the area there. So very simply, what we're planning to do, what are the options here? There's a lot of options. This is a very interesting case. But what are the options here? Well, there's no option. First of all, there's no option. No option for Barb is we have to take this tooth out. That's for sure. So we're going to take out the root. We're going to clean out the infection in there, right to the base of the bone. Doctor will be able to see right into the base of the bone with my high-tech technology lights here that you've seen in my other videos. I only go with that. That's Designs for Vision from, believe it or not, it's American, from somewhere in Long Island, New York. And we go in there with high-tech vision, dual beam, with special curettes from another company to effectively go around 360 degrees, but it's actually more than 360. It's hundreds of degrees of axis rotation to go and clean out that lobule of infection. We can take it even a bit further. We can send it for a 3D x-ray. And what's a 3D x-ray? 3D x-rays is that we see slices of the area like that, this way, and another way, like this. And we get 3D. But we don't need that because I know what's in it. We don't need to go to that expense. So we're going to take that out and then take out that tooth, take out the infection. Next, what about aesthetics? Well, it's a lady. She doesn't want to show without a tooth. That's obvious. So we have to think of a good solution, but the thing is there's no really good solution that is cheap, right? So we have to go top of the line in this case, which is an implant, but she can't afford an implant, which is understandable. So what are the options? Well, there really isn't any options, and let's explain why. So let's go to her mouth now and just take a look at that. Now, Barb's been my patient for 30 years, and I want to show you dentistry that I did for her, believe it or not, everybody. Veneers with old technology porcelain, 30 years old. Look at the sheen on the porcelain. Look at the lab did an awesome job. Look at that. That's 30-year-old porcelain. Can you believe it? Let's look to the side. There's a crown there. So even though it's old-time kind of dentistry in terms of the material science, it's actually still looking really, really awesome. And we've been monitoring it every 6 months for many years, and there's been no recommendations for any further treatment. Now, so here's the broken tooth right here. Okay, let's look up the center. This is a sick tooth. It has to come out of her jaw. Bite together for me. If we take a look at the tissue, actually, it's actually purplish. See, she's infected. She has a huge infection. Check out this side to the other side. Get a straight shot. Right, see to the right side? I want to direct your attention to this area. See, it's pink. Go to the front more this way. Go to the front. Yeah. See, it's pink. And let's look to the sick side right here. To go to the other side now. You see the difference in the color? And there's infection right there. So she has to go on antibiotics and Paradex. We're not going to do any treatment now. This has to cool down a little bit. If we leave it long enough, or she left it long enough, it'll go, the infection could go up under her eye. It can actually close her eye. I've seen that before. I've even seen sometimes if you leave it super long enough, it even go fistulate extraorally where the pus is here. And you do like Dr. Pimple Popper, and you do, not only do you freeze inside, which Dr. Pimple Popper doesn't do, because she doesn't go surgical like for dentistry, she freezes around here and takes out the infection. We're not anywhere close to that position. So let's look here. This is very unusual dentistry that I figured out for decades ago, because I don't know how I figured it out. So here I did inlay with a Pontic with an inlay crown on the 2/6. This is unheard of stuff from that time. I mean, it's pretty risky in dentistry. Why? Because how is it so supported? And here's the veneer to match this one on the front. So bite together. So you see her bite. There's no room. Just chop, 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 chop. See, no room for a tooth, for a denture in there. Even if we went the really high tech denture from Germany with the German materials, it's not worth the money. So we're really stuck here. So we could see if I have to. How are we going to help her? Well, she says she doesn't want to pay for an implant or can't afford the implant. She also, we figured out the denture's not going to do good for her. So we still haven't clarified what we need to do for her. Well, I think the only thing really to do for her is we're going to have to do some sort of prep on this tooth. Try to leave this back end alone because that's where it's holding on. I can do like a 3/4, 7/8, 6/8, something, I don't know, 3/4 crown maybe. I'll have to figure it out. Maybe just best case scenario, we get to just do a basic bridge here. The only problem is I might disturb the joint right here, and that's what I'm worried about. And if I disturb the joint here, then I'm going to lose this prosthesis, which is a 1x2. And then we get into really high costs, and I don't want to, and really hard work. And if you look at it, right here, it looks still pretty nice. So Barb and I are going to have a discussion, and we'll get to a conclusion. Okay.